So, good evening, my dear doctors, my dear students. Today, we are going to discuss about a topic which can come in your exam as a short note, and sometimes it is a part of long question, and that is GI modality. And a lot of MCQs are also based on GI modality, so we must know conceptual wise. Okay. So, first point is that which we need to understand in smooth muscles, the resting membrane potential is not fixed. See, normally RMP is always fixed. Okay. But in case of smooth muscles, so GIT is smooth muscles. So resting membrane potential, they are not fixed. They are oscillating. The first and the foremost point to remember here is that in case of GIT, resting membrane potential, they are fluctuating. They are oscillating. They keep on oscillating every time. They are not fixed. And these oscillating resting membrane potential are called as slow waves. Okay, so what are the slow waves? Slow waves are nothing, they are simply oscillating or fluctuating resting membrane potential. And these are called as slow waves. Slow waves are also called as basic electric rhythm. So you can say slow waves, you can say basic electric rhythm, both are same. Then next point, how they are generated. So who is the pacemaker of these basic electric rhythm? Who is the pacemaker of these slow waves? Then your answer is they are interstitial cell of Cajal. When I say Cajal, it is pronounced as Cajal but written like Kajal, Cajal. So pacemaker cells are interstitial cells of Cajal. They generate fluctuating oscillating RMP, and these are also called as slow waves or basic electric rhythm. Now, can they produce peristalsis? Yes or no? Sometimes they ask in Viva or MCQ, can slow waves, are they capable of producing peristalsis? Answer is no. Why? Because they are not action potential. They are simply slow waves. They are simply RMP. Only when there is a food in the GIT lumen, there will be a stretch, and that stress can cause entry of more and more calcium, and that can increase the fluctuation so that it can touch the threshold. Are you getting me? So whenever there is a stretch in the lumen because of the bolus of the food, then they are going to increase the oscillation. Only then they are going to touch the threshold. Otherwise, they are not. So only when they touch the threshold, they are going to produce spikes, and these spikes are called as spike potential. If you open the book Ganong or Guyton, you will see a diagram. Okay, and this diagram is very essential to understand GI mortality. In that diagram, it is given there is RMP which is fluctuating, and they are not touching the threshold. So when there is the food in the lumen, these fluctuation will increase, and only when these fluctuations are increased, they are going to touch the threshold, and as they touch the threshold, they are going to be spike, and these spikes are called as spike potential, and these spike potentials are actually action potential. So what are the spike potential? Spike potentials are, they are increase in the oscillation of RMP, and after touching the threshold, they are going to generate spike potentials, and these spike potentials are actually action potentials. And these are having the capacity to generate peristalsis. Are you getting me? So, can BER generate peristalsis? No. So, normally BER, they are not able to generate peristalsis, but when there is a food in the lumen, because of the stretch, because of the influx of the cation, they are going to increase the fluctuation. And when they are increasing the fluctuation, only upon touching the threshold, touching the voltage of the threshold, suddenly there is spikes. There will be spikes. Okay, after this session, you can just open your Guyton or Ganong, you will see the spikes. And in the exam, you need to draw those that spikes also. So those spikes are actually action potential, which can generate peristalsis. This is called as how electrical activity is converted into mechanical activity. Okay, so this is about conversion of electrical activity into mechanical activity. Now, mechanical activity or GI motility are of three types. One is peristalsis, Second is migratory motor complex. And third is your segmental movement. So whenever they ask you in the exam, in the Viva, you need to remember these three. There are three types of GI motility. One is peristalsis, you all know. Just to propel the food forward, you need peristalsis. Segmental movement is for mixing and churning of the food. So you need to absorb the nutrients from the food, and for that you need churning of the movement, churning of the food, so that nutrients can be absorbed, nutrition can be absorbed, and for that the type of motility is called as segmental movement. So peristalsis to propel the food, second is segmental movement, third is your migratory motor complex. They are also called as peristalsis of empty stomach. For example, you have not taken your dinner till now, and you have taken your lunch, 6 hours before. So whenever your stomach is empty, okay, MO cell, they are not M cell, MO cell will release motilin hormone that generate migratory motor complex. It's very simple to understand. So whenever our stomach is empty, in the empty stomach, MO cell or MO cells are going to release the hormone motilin. And motilin hormone are important for generation of migratory motor complex. These are also called as housekeeping waves. So these are also called as housekeeping waves. Why housekeeping waves? What is the purpose? What is the purpose of these migratory motor complex? Purpose is to clean the GIT before next meal. Okay. So before you start taking your dinner, your GIT should be clean. Your lumen should be clean. And to clean that lumen, you need that housekeeping waves, which are called as migratory motor complex. So migratory motor complex are actually peristalsis of empty stomach, and they are called as housekeeping waves. So every 90 minutes, we used to get these migratory motor complex. Okay, first there is a resting phase, then there is the incoherent and then coherent. They are called as simply housekeeping waves or migratory motor complex. Clear? Now, regarding peristalsis, we need to understand first of all there is a gut brain. Similar to this brain, there is a brain in your gut, and that gut brain is called as enteric nervous system. You can say gut brain, you can say enteric nervous system, which are of two types. One is called as myenteric plexus, other is called as Meissner's plexus. Myenteric and Meissner's. So when they ask you in the Viva or in an exam, what are the gut brain? The gut brain are of two types. One is your enteric nervous system. I mean, in the enteric nervous system, there's one is myenteric plexus, other is Meissner's plexus. Myenteric plexus is also called as Orbeck plexus. Myenteric and Orbeck, they are same. Other is called as submucosal plexus. So Meissner's is also called as submucosal plexus. So Meissner's plexus is for GI secretion, but this myenteric, this Orbeck plexus is for peristalsis, for GI motility. Please don't forget this. Once again, in your gut, there is a brain, and that brain is called as gut brain. Okay, that is called as gut brain or enteric nervous system. They are again of two types. One is your myenteric, other is your Meissner's. Myenteric plexus are also called as Orbeck plexus, and they are specialized for GI motility. On other hand, the other variety is called as submucosal plexus or Meissner plexus, and that is for GI secretion. So this is minimum which you should always remember regarding GI motility. Say in your exam, you will not have your notes, you will not have your books. So everything should be in your mind. And for that, interaction is very important. So if you discuss these topics with your batchmates, with your room partner, okay, then you are not going to forget. Without book, without notes. So first, read your book, read your notes, and then try to discuss. Okay, when you start actively involving, then you are not going to forget in the exam. Because in the exam, there is no notes, nothing is there. And for that, repetition is very important. Okay, and for that, I'm coming every Monday and Friday so that we can discuss in very casual manner just to refresh your content, your concept. So this is it for today. Again, on Monday, I will be discussing some more important topic at 9 p.m. Till then, all the very best.